So you know my name already, right? So today I want to talk about the gums that bleed. So we are going to talk about more of what causes it, how you can avoid it, and also talk about how you can treat it in case it's already happening. So mainly what causes the gums to bleed, in the medical language, gums, we don't call them gums, we call them gingiva. So when the gum is bleeding, usually it is most times it's bleeding because of something we call gingivitis. And gingivitis means that the gums have swollen, so the gingiva is inflamed, the gingiva is a bit swollen. And this swelling can be caused by many things. It can be caused by an infection of your gum. It could be caused an irritation on the gums, like a trauma. Maybe you've hit it with something or something like that. That can make the gums swell. So things you should, if like, let me say you want to avoid having the bleeding gums or having the gums swollen, there are many things that you need to do to prepare yourself to prevent these things. First and foremost, the gums could swell because you have a condition in your gene that whereby you can easily get gum disease. Some people, their gums easily catch diseases in a way that if some people, their gums are not closely attached to the teeth. So when you eat food, it goes in between the tooth and the gums. And remember, when you're brushing, you don't open your gums up and then brush down there. You don't. So you brush on top. That means the food stays under the gums. So when the food stays under the gums, what happens? The bacteria in your mouth, which are called the normal flora, the good bacteria, they can easily turn bad in the presence of food, especially if the food has sugar in it, because the bacteria will feed on that food, which is the sugars you've left on your teeth, and then it will start feeding on it, and then it will produce some acids, and then that acid can easily burn the gums, or the bacteria themselves can turn being like infectious, and then the bacteria can start giving you what we call a gum disease. Now they have stages. We usually have the first stage, which is the gingivitis, not that bad. Then we have the next stage is the mild periodontitis, which is also a gum disease. But then with the gingivitis, your gums can swell. They can bleed every now and off, like when you're brushing, sometimes they bleed, sometimes they don't. And then with the periodontitis, the mild stages, the early stage, usually what happens, you will start noticing that your gums are starting to, they are bleeding more. And they start to hurt, like when you're doing nothing, just feel like your gums are paining or they're itching, like you want to go in and scratch them. Then they can also, maybe sometimes when you go to the dentist and they put something we call a probe in between your gum and the tooth, what can easily happen is the probe will go a little bit deeper to 2 millimeters to 3 millimeters. Then there is a problem, is early periodontitis. There, I'll give you a solution what the dentist will do. And then there is what we call the chronic periodontitis. By this stage, you could have noticed that your teeth have started becoming wobbly. That is, they started moving, like they're mobile. And also it has stages. The mobility can be the 1, the 2, the 3, depending. But if you feel your teeth have started to move, meaning the attachment of the gums to the tooth is being tampered with. So there is a disconnection between the gum and the tooth. Let me give you an example, very simple. Like, do you know, like a tree, what makes a tree stand firm is the soil. The tree is very important, but the soil is also very important because holding the tree. Imagine you removed all the soil around the tree and remove everything around the tree. What's going to happen? You're going to leave the tree isolated, and if strong winds come, that tree can easily fall. That's what happens with the gums. Your tooth can be very healthy, but the gums around it are infected. So if you see the first bleeding, you ignore it. Then the second bleeding, you ignore it. And then you start seeing them becoming wobbly, meaning the gum is fully getting disconnected to the tooth. So your teeth will start shaking and some people will fall out. So we can't wait for the chronic stage, because with the chronic stage, what happens, even the bleeding stops. So you stop seeing the blood that used to come a lot, and now you're not seeing any blood coming anymore. If you used to see, like, maybe your teeth used to be like paining and itchy, they will stop, but then they will start changing color. Maybe they will get that weird blue towards, like, you know, like when blood when blood is not moving properly, that kind of swelling, the bluish, it can start to come to that color. Or you can start having really bad breath. That is also